So, good evening, ladies and gentlemen. Welcome to the 11th annual conference of Heart Failure Association of India. It's a pleasure to welcome all of you to the Queen of Arabian Sea, Kochi. In this conference, I will be presenting on chronic therapy of heart failure. We know that heart failure therapy has evolved over these years. In the 1980s, where you only had diuretics, now we have an array of therapy which had shown significant benefit. It is said that if you give this therapy of these 4 drugs, or what is called the 4 pillars of therapy, to a 55-year-old man, he will gain 7.5 years of life. So that is the benefit with this therapy. That is very, very important. So the problem is that we are not able to provide the therapy to all the people due to many reasons. Physician inertia is very important factor. Patient-related factors are very important, like low blood pressure, low heart rate, most importantly renal dysfunction. All these are patient-related factors. Then there are issues related to the societal factors like affordability, accessibility, and availability of the drugs and the related issues. We know that 90% of Indians spend out of pocket for their drug therapy. So that also is a major issue. So now there are systems initiated by the government like the Jan Aushadhi scheme, which will benefit many of the patients who cannot afford these drugs. So I hope that in the future the therapy of all these 4 drugs will improve, and it will improve the outcome of these patients. In addition to that, we have comorbidities like treatment of hypertension, treatment of iron therapy, treatment of depression, hypothyroidism, and frailty is also an important comorbidity. So we have to have physical rehabilitation of these patients, which will also improve the outcomes and improve the confidence of the patients and improve the overall outlook of the patients. So the heart failure therapy has to be a multifaceted rather than concentrating on the pharmacotherapy. Pharmacotherapy is the most important, but other factors also you have to consider, especially regarding quality of life. So in that way, I hope this conference with these deliberations over the last 3 days must have helped to send the message to the attending people that the therapy is important. It has to be provided to the needy patients, and that ultimately will lead to many lives saved and improve the survival of this.